Disabilities are not rare. 1 in 4 people in the United States has a disability. These individuals are particularly vulnerable and are more likely to live with complex and poorly managed chronic health conditions. Data show that they have limited access to quality health care and health preventative programs, will often have undetected poor vision, and are more likely than the general population to suffer from undiagnosed mental health conditions. Additionally, this population is 5 times as likely to have diabetes, twice as likely to have cardiovascular disease, and twice as likely to be obese. Despite these statistics, there is no requirement that medical schools or residency programs train future medical providers on how to care for and treat patients with intellectual disabilities. With no existing curriculum in place and prior experience and love for this population already in my heart, I decided to make one to impart a change. The educational session I developed consisted of a 60-minute lecture presentation, a 30-minute panel discussion, and a 90-minute standardized patient experience. The lecture focused on health disparities, communication strategies, techniques for establishing rapport, and ways to identify and overcome barriers. The panel discussion allowed participants to hear about athletes' personal experiences. And finally, the standardized patient case allowed students to practice in a safe environment. To allow students real-life experience with this patient population, I partnered with Special Olympics to bring MedFest to Central Wisconsin. MedFest is a free event hosted by Special Olympics where athletes can go and receive a free sports physical from a trained healthcare provider. 13 students chose to participate in MedFest, where we provided care and free physicals to over 40 Special Olympic athletes. After participating, individuals self-assess their pre- and post-event perspectives. Results demonstrated that the educational session increased medical students' perceived comfortability, knowledge, ability to communicate, perspective, confidence, and ability to provide care, while participation at MedFest provided volunteers with confidence, valuable clinical techniques, and practical communication skills. Working on and developing this project has been monumental in my journey to discovering the type of physician I wish to be. Going into medical school, I was unsure of my path, but through this project, I have found my passion for family medicine and disability health. I have also come to recognize both my desire to be involved in medical education and to create a lasting change in disability healthcare. I hope that the next generation of healthcare providers will see the healthcare needs of people with intellectual and developmental differences not as burdens but as gifts. Gifts to be recognized, treated, and cared for by every healthcare provider confidently to eliminate the health disparities I talked about earlier. I am honored to say that MedFest will continue on in Central Wisconsin on a yearly basis, and my educational session will be worked into the Medical College of Wisconsin Central Wisconsin's curriculum moving forward to impart change on the next generation of healthcare providers.